of topic or pertussis. It is a highly contagious bacterial disease that causes severe, uncontrollable coughing, fits that can leave inevitable whooping for deep breaths afterwards. It affects people of all ages, but is especially dangerous and even fatal for young children and infants. So, the sound is like this. Okay, so you can wait for just gonna edit that for let's see, that's here. What does it sound like, looks like, see? Okay, caused by a bacteria. Of course, bacteria. If it is bacteria, antibacteria. But we will continue first to the causes, no? What does it cause? Caused by bacteria, Bordetella pertussis, transmitted from person to person through infectious droplets, produced from coughing or sneezing. People become infected by inhaling these droplets or touching surfaces. Now, I don't know when is the lifespan of that bacteria if it goes to the surface, but be careful touching surfaces with infected droplets and subsequently touching their eyes, nose, or mouth. Okay, that is the point of entry. Again, the sign symptoms. Okay, the symptoms usually around 5 to 10 days after infection, but it takes long as 3 weeks to appear. Infected individuals are most contagious during the first 2 weeks of symptoms. During the first 1 to 2 weeks of symptoms, an individual will experience symptoms resembling the common cold. This one, common cold, such as fever, runny nose, and mild cough. Among infants, apnea or pauses in breathing is typical. So when the disease worsens, an individual will experience paroxysmal coughing, many rapid violent coughs, followed by a whoop as the individual struggles to breathe and recover. Vomiting and exhaustion commonly followed these paroxysmal coughs. This stage of the disease can last for 1 to 2 weeks and has been documented to last as long as 10 weeks. So the worst condition, wait lang. So if it is 10 weeks, how many months is that? I got 4 weeks in 1 month, 2 months, and then 2.5 months. So the worst condition, the more frequent the paroxysms, which would also become more common at night. Okay? So among babies, paroxysmal coughing is not very common. Instead, during this stage, apnea is more common, becoming evident when the babies turn blue because there is no oxygen delivery or cyanotic. Okay, low oxygen saturation, hypoxemia. So during recovery, coughing fits can still return, although milder and less common, and may persist for many months. So what are the management here? So of course, the diagnostic, treatment, and other care, antibiotics are recommended for treatment and can actually shorten the duration of the disease, as well as the time that an individual can infect other people. This is why it is important to see a doctor once the individual develops a cough that keeps worsening or does not go away, or any of the other symptoms mentioned. Coughing, giving cough medications or cough syrups is not recommended. Okay? Not recommended. Okay. Excuse me po. Okay. Let's continue. So, what can you do now? What you can do? Prevention and control. Pertussis is preventable through vaccination. Vaccine is given as a combination. It can also covers the diphtheria and tetanus. Okay, the vaccine is widely available and routinely given during infancy with booster doses throughout childhood. Vaccination can prevent infection or in areas where the disease is still widespread. Can make the course of disease milder. To prevent the spread of pertussis or getting infected, proper cough and sneeze etiquette should be practiced at all times and taught to children regularly. So, you need to cover your mouth and nose when coughing or sneezing with a tissue, handkerchief, or one's upper sleeve or elbow, and not with your bare hand. Dispose of used tissue properly. So you need to wash your hands with soap and water or alcohol-based sanitizer thoroughly for 20 seconds. Okay, that is the proper way. So, as much as possible, at home, individuals displaying symptoms, coughs or colds, should be isolated from other people. So that is the on how to prevent and control this bacteria. This bacteria spread. Okay. So I hope we have learned from this topic, and I will continue to master this on how to teach this pertussis coughing. But I would like to add, well, if they told this that if it is droplet, as far as I remember, if it is droplet, how many distance, what is the distance on how to approach the patient, what is the limitation, can you how of course the distance is very important, so as far as I know, if it is droplet, you need 3 meters away, away from the patient, and that is how that is the safest way on how to prevent transferring the this bacteria. If you want to talk to the patient, you need to talk 3 meters away, and but if you want to go to the patient, you need to wear mask. So if the patient is adult, child, they can wear face mask with precaution. Okay. If it is infant, of course, you need to isolate it, like isolate the infant. Of course, if they turned blue or cyanotic, if the doctors ordered oxygen, giving oxygen, proper treatment, so to prevent the cyanosis, okay, hypoxemia. Okay, what else? 5 moments in hand washing. Don't forget proper hand washing. It says here that you need how many seconds? Using alcohol-based sanitizer thoroughly, 20 seconds. If washing hands with soap and water, okay, there is a WHO lecture on how to do hand washing. Okay, I think I need to return that topic also. Okay, so thank you. Ingat. Take care. Bye-bye.